Hi, my name is Cody Kyle. I'm a licensed marriage and family therapist. I'm not a doctor, and this video is for educational purposes only. Today I'm going to discuss EMDR, eye movement desensitization reprocessing. Yes, I can say that again. Eye movement desensitization reprocessing. During this video, I will refer to it as EMDR. And today I'll discuss EMDR in simplified terms so it's easier to understand. However, after the video, head over to my website at healingwithcody.com and there'll be a PDF posted there with more in-depth information that contains resources. So what is EMDR? EMDR is a short-term, non-invasive type of exposure therapy used primarily to treat post-traumatic stress disorder. Traumatic and painful memories can cause post-traumatic stress symptoms when they are not processed completely. Those unprocessed memories contain emotions, thoughts, beliefs, and physical sensations that occurred at the time of the event. When sights, sounds, words, smells trigger those unprocessed memories, then the event is re-experienced. This experiencing leads to emotional distress and other symptoms. EMDR essentially rewires your brain to remove the negative charge of the traumatic event so that you can remember the details of the event without the feelings of distress. So how does it rewire your brain? This explanation may sound complicated, but it's not. Basically, bilateral stimulation is paired with distressing memories to change beliefs about the event by activating each half of the brain to create new neutral connections. Probably better if I just give you an example, and I'll give you my example. I was actually at a seminar for EMDR, and while I was sitting in there, they were going, over all the things that it helps with and talking about different traumas and so forth. And they were, the whole list of traumas. I was like, ooh, I have that one. I still have that one. Ooh, I thought I got rid of that one, but I didn't. So I was in there as a clinician, but I realized, man, I don't need to learn how to do this. I need to have it done to me. So I knew the doctor actually that was giving the seminar, and I contacted her afterwards. And because I knew how to prepare for the session, I outlined all my traumatic events on bullet points, and I had 4 pages. And I ended up going to Dr. Linda Hazel, and we only had 6 sessions. I do believe it takes much longer than that because most people they can't identify what their problems are, or put it in chronological order and so forth. So anyhow, I was ahead of the game there. The 2 primary areas that I focused on, the first one was when I was hit head on by a semi at age 25. That was a big one. And then specific sexual abuse incidences. So that was my primary focus going in there. What was a typical session like? Well, I held these EMDR tapers, which are like paddles, and they made quiet beeping sounds, and I just held them while we discussed all the things that brought me emotional distress. And we worked through the 8 phases of the EMDR process during that time, and it was very painless. But basically how a session goes is we're discussing, things. And so I'll give you an example. I was discussing the first time I was sexually abused, and even at that time, she wanted to know, what was my emotional distress about that incident, and I had an 8 out of 10. And we kept working through all the EMDR phases until it was down to a 0. And then the next time I went back in for a session, we brought that same incident up. And if I wasn't at a 0, we would work through that process again until I got back to a 0. So I still remember those things, but I don't have any emotional distress. It basically took all the pain associated with my memory. It was wonderful, and then after the sessions for a few months, I felt like I was a snow globe, like I had been shaken up, and I was emotional, but not stressed out, not sad, just felt emotional. And then all of a sudden, a couple months later, I felt like the fog had lifted. I felt lighter and I felt happier. And I was like, oh, finally kicked in. Took me a little bit, but I'll tell you, post EMDR, I used to not be able to drive around semis. It would just make me so nervous. I would almost have a panic attack. But after EMDR, that it doesn't bother me at all. We traveled across the country in a 30-foot RV, and I was driving a 30-foot RV, pulling a car and passing semis, and I did not have hardly any distress, or I had a little distress, it's a little scary, but I didn't have near the distress that I once had, just driving in Nashville traffic behind a semi. So that was good. And then as far as the sexual abuse stuff, I remember everything, but I don't have any emotions. Like it doesn't bring me any distress at all, which is wonderful. I can't tell you how great that is. But anyhow, EMDR is a wonderful tool. And if you have anything you'd like to work through, I would highly recommend this healing modality. Very powerful for soldiers. They use it, for PTSD, rape survivors, and then anyone who's experienced any type of trauma. So that is what I have for you today. Again, head over to my website, healingwithcody.com, and please like, share, and subscribe. Talk to you next time. Bye.